Hi, everyone. My name is Rabia and my colleague Barb, and today we're going to be sharing our project, which is regarding CMV. And for our project, we were studying parent perspectives on universal newborn screening for congenital cytomegalovirus. I was afraid I would get that wrong, which is abbreviated to cCMV.
Okay, so curiosity is just killing me here. I'm just wondering who in the audience has heard of the cytomegalovirus before they started the PACER journey, maybe in the cohorts that we. So there's a couple hands going. Yes, of course, through the back. So not many in this room have even heard of the word cytomegalovirus. And I was one of them before I started this program. So we're all in this together in the lack of awareness. So there's two terms that we use a lot in the research when we were studying CMV. The first one is just the virus itself, cytomegalovirus. It's a really common virus. Generally, about 50% of the adult population would have had cytomegalovirus at some point. And once infected, the virus stays in your body for life. So it's kind of one of those viruses. Most people don't know they have it. It can present with a sore throat or swollen glands or a fever, but nothing that would be out of the norm for other kinds of viruses that we get. So it's not a cause for concern for most people who are healthy. When it becomes a cause for concern is if a pregnant woman or pregnant person contracts the virus during pregnancy. The virus can then go through the placenta into the fetus, and that can cause problems for the fetus. So congenital cytomegalovirus is when a baby is born with the virus. So as opposed to contracting the virus as an adult or as a child, you are actually born with the virus. So that is the difference between the two terms. So when we're looking at the numbers, approximately 1 in 200 unborn children are infected during pregnancy, and 20% of those may go on to develop permanent disabilities. And those disabilities can range from mild to profound. So when we're looking at the numbers, and then we kind of consider the statistics, that's a lot of kids that are born. And really the number of kids that may go on to have a permanent disability is kind of on the same level as the number of kids that are born with Down syndrome. And I'm willing to bet that almost all of us, or if not all of us, have heard of Down syndrome before, right? So when we're looking at comparable numbers, the question is maybe, why have we never heard of CMV? It's also the most common non-genetic and preventable cause of birth defects and hearing loss in infants. And there's little awareness, and especially for that population of pregnant persons for whom it's really, really crucial that they know about this potential infection of their fetus. So universal newborn screening for CMV is offered only in 2 provinces in Canada right now, Ontario and Saskatchewan. And Alberta has just committed to adding it to their newborn screening platform, which is great. We're hoping that that happens quickly. But parental anxiety has been cited as a possible deterrent for adding it to those screening programs. So the thought from medical professionals in the past and currently is that when you look at only 20% of them going on to have permanent disabilities, that means 80% of those babies who have cCMV are not going to experience permanent disability from it, and they wouldn't want to worry those 80% of families for nothing. So that's kind of the background to where we end up with our topic.
So considering that background, our research objective was to understand parents and expectant parents' perspectives on universal newborn screening for CMV. I'm going to skip over this PACER process slide because it's been mentioned previously a little bit. I'll go through the specifics of our set, collect, and reflect. So for our set, we had input and feedback onto our research question and our research design by 5 patient partners. And the data that you will be seeing today comes from the collect portion, and we had 12 participants who we coordinated with to gather that data through 2 focus groups and 6 interviews. And then 7 of those 12 participants came back to join us in a reflect session where they helped us review the findings and validate the data and make sure that we were representing what they had told us correctly. And the recruitment criteria for those 12 participants that we gathered data from was that you had to be someone over the age of 18, you had to have experienced a pregnancy in Canada and have lived experience of cCMV. And most of these people were recruited from local patient support organizations such as CMV Canada and the social circles of our patient partners and our patient researchers.
And just actually to let you know, it's not on the slides, but 2 of the team members have children with cCMV. So that's kind of where this project started originally too. So we had 12 participants. They all had children. They were all parents of children that have cCMV. 11 of those children have symptoms of cCMV. So they're experiencing disabilities, a range of disabilities due to cCMV. There is 1 little type that is currently asymptomatic. And with cCMV, again, this wasn't mentioned in the slides, but you can be born with cCMV and have no presenting symptoms, and it might stay like that for your lifetime. You may be born with cCMV and have no presenting symptoms, and they may develop later on, 2, 3, 4 years of age. And you may be born with cCMV and have very noticeable symptoms at birth. You might fail your hearing newborn screening test and things like that. So there's a range of how it presents. So this little type that is currently asymptomatic, the parents are hopeful that this little one may not develop symptoms down the road, but they are watching and they are gaining information and they are looking for things or just being aware of things that might develop. So there's 5 children that were diagnosed through provincial universal newborn screening, and there were 7 that were diagnosed outside of that. So whether the diagnosis came while they were still, unborn through ultrasound, or whether the pregnant person had been diagnosed with CMV, and so then they looked for it in the unborn child, or they were born and had some kind of symptoms that they required testing for. So, and then we had like 2/3 of the participants were women, 1/3 were identified as male, and we had representation from 5 provinces over the country. So we thought that was quite good. And then 2/3 of our participants came from urban centers and 1/3 came from rural. So we were pretty pleased with the diversity that we reached in our participant population. So this was a graphic that actually Rabia designed that represents our key themes. So the first theme was just cCMV diagnosis. What was that actually like? From the time that you were told that you as a pregnant person had CMV, or from the time that your family was told that your child had cCMV, what that process was like. Theme 2 came as, not surprisingly, attitudes about screening. That's actually what we were asking about. So that was our second theme. And then our third theme was kind of, maybe it shouldn't have been a surprise, but it wasn't something that we were looking for. It wasn't something that we were directly asking about, but it came out loud and clear. Awareness. And we've got all these arrows pointing to the awareness about screening and the awareness about cCMV. So the theme of awareness kind of impacted all of the other themes as well, and they're also interconnected.
Okay, so I'm going to talk in detail about some of these themes, and at the end, I'll give you guys a few seconds to read over some of these quotes that we took from our participants. So theme 1 was really the CMV diagnosis journey, prenatal, postnatal, the process through which our patients received their diagnosis. And the 3 things that were apparent to us through their diagnosis journey was 1, that quick access to medical follow-up post-diagnosis, so that having a diagnosis was really a gateway to getting those supports and getting them timely. So one of our participants noted that her daughter who was born with cCMV, she received antiviral at 3 months of age, and she thought it was no coincidence that her development ever since has been lagging for 3 months consistently. Another participant noted that their daughter had hearing loss at birth, but not having that diagnosis and not getting the treatment right away. By the time she was able to get onto the antiviral, she had gone from mild hearing loss to profound hearing loss. So having a diagnosis helps these patients get timely care and get it in a manner that is able to treat these children. Second was supports and resources. Now, we had a diverse opinion here. Some patients felt very supported by their medical professionals or caregivers. They were given a diagnosis and provided, given a right direction to follow, whereas other people felt like they were handed a diagnosis and here's your diagnosis and we don't have any more to tell you about it. So that was definitely a big theme within the diagnostic journey. And last of all, medical professional communication was another big theme. A lot of patients felt like there was a lack of empathy and a lack of care coming or communicated to them from their interactions with the medical professionals. So as the quote here says, and just like very frivolous, like not thinking through these words, that really took a toll on me. So when patients were already distressed or experiencing emotional distress, they felt like they could have used a little bit of more empathy and care coming from these medical professionals. Our second theme was attitudes about screening. And the first one was, as you can say, oh, actually, I didn't give you guys a chance to read the quotes. Let me quickly go back and I'll give you a few seconds just to read over these. Okay, so our second theme was attitudes about screening, and this is how people felt about having CMV screening. So first sub theme was there was an overwhelming amount of support for screening. And again, linking it back to our last theme, people felt that if you were screened, you had a diagnosis, and if you had a diagnosis, you had the right supports and you had them in a timely manner. So as the quote says, this is a no-brainer. We need to have screening. And since it's already been implemented in 2 of the provinces, our patients felt that we should implement this Canada-wide. Some of our participants actually, in talking about support for screening, thought it would be unethical of the medical professionals to withhold information or to withhold important medical information that would impact their babies and impact their children. And that takes us to the next piece. The anxiety is not a deterrent. That from the medical perspective, anxiety is always seen as a barrier to implementing screening, that we don't want to stress out the parents undue if their children are going to be asymptomatic and not have anything to worry about. But what we heard from our patient partners is that anxiety is not a deterrent. And in fact, if you do not have the right information, if you do not have the knowledge, your anxiety is tripled. It is multiplied many folds. As the quote says, no matter what the anxiety is, multiplied by 1,000. If you don't have a diagnosis, you're looking back and saying, what if I could have? So all our patients supported screening, and they made it clear that their anxiety is not a deterrent. And as parents, they're capable and can handle the stress and can handle what has to come with the diagnosis. Now, our last theme, awareness, really for us spoke to the beauty of doing patient-centered work. And it really shows the power that experience of people with the power that people with lived experience bring to this work. Now, awareness was not something that came up during our literature reviews. It was not something that we were anticipating, but it was pervasive in our discussion of all our themes, in all our focus groups, in all our conversations. All our participants reinforced again and again, why don't we know about CMV? Why is there a lack of information about CMV? So the three key themes that emerged here was a general lack of awareness. Well, nobody told me what it was. lack of awareness during pregnancy. And because nobody told me, I couldn't prevent it. And maybe there was something I could have done. And for a lot of mothers, there was a lot of mom guilt, as in I could have done something to prevent this, but I didn't. And now I passed this on to my child. So a lot of patient partners felt frustrated with, the lack of information. And lastly, tying that back to screening, a lot of people thought screening would necessitate providing information, or screening would contribute to an awareness that if you had a process through which you were screening children, then that would necessitate medical professionals to inform patient families about what they're screening for, why, and why they need to know about it. So yeah, in a nutshell, those were our 3 themes.
So we've got the 3 recommendations that are aligned with the 3 themes. So obviously the first one is universal newborn screening of cCMV should be implemented nationally. That was just categorically universally stated. The second one is raising general awareness of CMV and how to avoid contracting the virus during pregnancy should be a priority. We need to know about this, and we need to tell people so that they can be careful when they're around a pregnant person. We need to go to the daycares because, again, we can't tell you everything that we learned in this process. But one of the most common ways for a pregnant person to get CMV is through their toddler in daycare. So the toddler goes to daycare, is like all over the germs in daycare, right? They bring it home to their pregnant mom, and then the pregnant mom passes it to the fetus, right? So we need to go to daycares. We need to go to medical schools and really raise awareness with the medical professionals and how to actually communicate this to pregnant people and to women of childbearing ages and the general public, so that when they're around people, they know how to prevent it from spreading. And then the third one is the medical professionals need to provide coordinated and comprehensive resources and support at the time of the diagnosis. And if we do put this on our screening platforms, we will be diagnosing more children. We will be, right? So we need to provide the infrastructure to support those families. 80% of them may never need, the actual early intervention or the treatments or the cochlear implants that might come from some of the other families, but we need to provide that follow-up, and we need to just follow up with those kids just to see if anything is coming or if anything is changing in their development so that we can catch it as early as possible. So those infrastructures need to be put into place when we roll out this universal newborn screening. And so the conclusions that we came to, really simple. Children with cCMV and their families deserve every opportunity to realize their best possible outcomes. We don't want to wait until the child is 2 years old and they have a profound hearing loss and they have other neurological deficits or developmental impacts till we diagnose it and then go, oh, okay, we could have done this sooner. So we're not going to wait. We want every child and every family to realize their best outcomes possible. And when deciding whether to implement universal newborn screening, it's imperative to look to the people with lived experience. And that, again, is the people that have gone through it and that are going to be impacted by it. And that was a conclusion that was pretty straightforward to us when we talked to our patient participants, especially around that piece around anxiety. There is some stress and there is some anxiety when you get a diagnosis, but all of the families were like, does not outweigh the risks of letting a child go through without being screened and then developing those permanent, possibly profound developmental impacts. So we need to consult them. And that's it.
And just before we end, we want to thank Pacer, Dr. Santana, Dr. Eliana, Marcia, Ingrid, everybody for being an incredible support during this process. We have learned a ton, and I feel like being a part of this project, doing this work has transformed us on a personal level. So yes, thank you very much.